Hello everyone, welcome back to Believer Science Academy, Bengaluru. This is NCERT discussion, and in today we'll be discussing NCERT Polity, class 7th of NCERT. Okay, in this session, in this series, we already discussed class 6th Polity and class 7th top chapter 1 of class 7th Polity, and in today we'll be discussing and we'll be analyzing chapter 2 of class 7 NCERT. So the chapter 2 of NCERT class 7 is role of the government in health. Okay, in this chapter we will analyze what do you mean by health, what is the condition of India, distinction between private and public, and some examples of best healthcare practices within India and around the world. Okay, we will analyze the challenges in Indian healthcare sector and we will also try to find a solution for this. Okay, so before we dwell into the chapter, there are certain keywords which we have to understand. Those keywords are okay, just a moment. So first you have to understand certain vocabulary keywords. First is medical tourist. Who are the medical tourists? They are the tourists or foreigners who come to our country for the medical treatment at hospitals that charge the reasonable cost. Okay, so there are different types of tourism. One is cultural tourism, another is sightseeing, etc., etc., and other type is medical tourism, or in the broader aspect we can also call this as wellness tourism. Okay, within wellness tourism some subpart is medical tourism. Okay, so the very purpose of tourism or very purpose of touring India is to get medical access, is to get medical treatment. Why they prefer India? They prefer India because medical treatment is relatively lower compared to the particular countries. Okay, and then within diseases there are many types of diseases. One is communicable diseases, another one is non-communicable diseases. What is communicable disease? Communicable disease are those diseases that spread from one individual to another individual. Okay, from one person to another person through water, food, air, etc. Then what is non-communicable disease? Non-communicable is simple. It is non-transferred from one person to another individual. That non-communicable can be lifestyle diseases, can be genetic diseases, can be hereditary diseases, can be allergies, can be cancer, etc., etc. These cannot be transferred or communicated from one person to another person through water, food, air, etc., etc. Okay, so for example of communicable diseases AIDS, malaria, typhoid, TB, etc., etc. Example of non-communicable diseases is hypertension, blood pressure. What else? You can also talk about cancers, etc., etc. These are non-communicable diseases. And within healthcare services, there are two types. I already told you, that is public and private. What is public? Public is a service that is meant for all people in the country and it is organized by the government of the country. Okay, for examples, schools, hospitals, etc. Within this public, one aspect is public healthcare services. Okay, then what is private? Private service is a service that is organized by an individual or the company for their own profit. Okay, within private there can be private education, private schools, private hospitals, etc., etc. Then what is OPD? OPD is, it refers to outpatient department. This is where people are first brought in and treated in a hospital without being admitted to any special ward. OPD is a general ward. After treatment or after diagnosis in the general ward, then they are transferred to a special ward based on the diseases or based on their medical condition. Okay. What is RMPs? RMPs is registered medical practitioners. They are mainly found in rural areas. Why have I focused on these words? Because these words are repeated again and again in this chapter, so you don't get confused. Okay, so I already discussed the vocabulary. Now we will move into the main chapter. So in this chapter, first we'll understand what do you mean by health. Okay, first and foremost we have to understand what is health. Health means our ability to remain free of illnesses and injuries. There are certain factors which affect our health. Okay, so we'll understand the different factors, but before that we will understand health in a broader way. Okay, health is a vital aspect because only healthy people can prove themselves resourceful. Okay, a person who is unhealthy is unfit for achieving a particular task effectively or efficiently. Okay, only when a person is healthy he can be or he can become a resourceful person or he can achieve a task efficiently or effectively. Okay, health means our ability to remain free of illness and injuries. In a broader sense, health means something more than this. Okay, in a narrower sense, health is remaining free of illness and injuries, but in a broader level it encompasses various aspects, such as apart from diseases we need to think of other factors such as clean drinking water, pollution free surroundings, etc., etc., which have the capacity to affect our health. Okay, all these aspects are included in health. Adequate food is also essential for keeping ourselves in good health. All these points or all these factors encompasses health. A life with stress will lead to illnesses, hence we need to be without mental strength. So this mental aspect is also included in health. Okay, it is not just the physical state, but it is also the mental or psychological state that is important for considering a person healthy. Okay, thus good health includes both sound mind as well as sound body. For achieving this good health, we need proper healthcare facilities to maintain good health. Okay, so what do you mean by healthcare facilities? Healthcare facilities, it includes health centers, hospitals, laboratories for tests, ambulance for services, blood banks, doctors, nurses, other medical practitioners, etc., etc. All this comes under healthcare facilities. Okay, so in order to run such healthcare facilities, you need certain resources. Those resources are health workers, nurses, qualified doctors, etc., etc. And you also need certain inputs. What are those inputs? Those inputs are medicines, equipments that are essential for treating patients. Okay, all this comes under healthcare sector or healthcare facilities. In India, there is no dearth of qualified doctors. There are a large number of clinics and hospitals too. Perhaps, therefore, a large number of medical tourists come to India for treatment at a reasonable cost. Okay, so that is the perks of having a large country with the qualified doctors. So in terms of statistics, India is the fourth largest producer of medicines in the world and is also a large exporter of medicines. Okay, but despite all these things, the health situation in our country, in our own very country, is very poor. The main reason is that the government fails to make necessary healthcare available for all. Okay, there are many other reasons also included, but the main reason is that government somehow is unable to provide healthcare facilities to everyone in the country. Healthcare facilities can be divided into public healthcare facilities and private health facilities. So public is a chain of health centers and hospitals which are run by the government. It is found in both the rural as well as urban areas. Okay, so at the village level, there are health centers where there is usually a nurse and a village health workers, and they deal with common illnesses which plague the village level. And at the district level, there is district hospitals that supervises all the health centers of a particular district. And certain big cities, there are many government hospitals within the big cities such as Bengaluru. Under the public health system, quality health care services are provided either free or at a low cost, so that even the people or the poor can seek the treatment. Okay, so this public health system, no one is excluded. These are non-excludable services provided by the government. Okay, so that no one based on their economical condition, no one based on their social conditions are excluded from these essential services. Okay, under this public system, action is also taken to prevent the spread of diseases like tuberculosis, malaria, jaundice, cholera, diarrhea, chikungunya, etc. diseases. And a wide range of private health facilities exist in our country. A large number of doctors run their own private clinics. Okay, there are small clinics which are run by the doctors themselves. Okay, doctors, instead of working under the government or working under the large private institutions or private hospitals, they decide to work or create their own clinics. Okay, they establish their own clinics, and under which they will be providing services at a particular cost. Then in the rural areas, registered medical practitioners, okay, RMPs, are found, whereas in urban areas large number of doctors can be seen. And there are hospitals and nursing homes that are privately owned and not run by the government. These comes under the private healthcare facilities. Then, unlike the public health services in private hospitals, patients have to pay a lot of money for their treatment. This is where the negative aspect of privatization of healthcare comes in. Okay, because what is the main aspect of running a healthcare for private individuals? It is making profit, whereas a healthcare system run by the government, their aim is to provide healthcare services to every individual, promoting welfare. But whereas private, it is to generate more profit. In order to generate more profit, they provide services at a higher cost compared to public services. This aspect is negative. This aspect makes people to spend more out of their pocket, which pushes people into below poverty lines in India. Okay, in our country, private services are increasing, whereas public services are not. Okay, as the private services are run for profit, the cost of these services is rather high. As a result, poor people find it difficult to get treatment in these services. Okay, so adequate healthcare is not available to all in this country, because only 20% of the population can afford all the medicines that they require during the illness. Okay, if these medicines are provided at free of cost, okay, then everyone will be available, or everyone will be able to afford these medicines. But since most of the healthcare facilities in India are owned by the private, they tend to charge a higher cost for the medical services or medicines. As a result, only 20% can avail all the necessary medicines during the illness. Then it has been found that 40% of the people who are admitted to hospital for some illnesses have to borrow money or sell some sort of their possessions to pay their expenses. Okay, this is very wrong, because in a welfare country, okay, India is a welfare country based on the principle welfare. In a welfare country, the ideal situation is that each and every individual should be able to get healthcare services free of cost. Okay, they don't have to sell their possessions, they sell their properties so that they have to get these healthcare services. But unfortunate event in India is that many people, that is of 40% of Indian population, have to either borrow money or sell their properties or possessions in order to avail the medical expenses. Okay, many times you might have experienced in your own families. In families, mostly middle income and lower income families, whenever there are family member is induced with a particular diseases, a long term diseases, or any sort of surgery or operations, then the cost of those operations are so high that we have to either sell some sort of property such as land, house, or etc., or you have to borrow money from someone else at a higher interest rate. Okay, which puts lots of pressure on the family, the earners, as well as the individuals of a particular family. And then most of the times it pushes them into poverty line or poverty of India. So for the poor, every illness is some sort of curse. Okay, illness is some sort of curse, that is sharp. As they are unnourished and live in unhygienic conditions, they frequently fall ill. The expenses on the illness makes the situation even worse. Okay, this is a vicious cycle of poverty and diseases. Okay, because an individual is poor, he is living in unhygienic conditions. Okay, because he is living in unhygienic conditions with improper sanitation, improper waste management system, improper drainages, etc., etc., he tends to get diseases higher rate compared to people who are living in a better mannered or better conditioned houses, first such as rich people, because they tend to get more diseases, they are more tend to get illness, and they are more prone to spending more money. Okay, money spent is more, which means they are pushed further into the poverty. This is a vicious cycle which the poor people of India suffer from. Okay, whatever the earnings they make from their like jobs, etc., etc., during certain period of time, whenever they fall ill, or whenever they get disease because of the unhygienic conditions, whatever the money they are earning is spent here. Okay, so the money they are earning is spent on the healthcare services. As a result, they are further pushed into poverty because they are remained with less money to spend on other aspects such as housing, education, etc., etc. So for women's health is associated, it is easily ignored. Within within the healthcare inequality, there is inequality of genders also, whereas males and females, okay, males healthcare is considered, whereas females healthcare most of the times is ignored. Okay, is ignored. So there is inequality or discrimination based on the gender in healthcare facilities also. And there is social discrimination in the healthcare also, that is many tribal areas have fewer healthcare centers. Thus we can say that without a doubt that the health situation of most people in our country is not good, and it is not based on the democratic lines, it is undemocratic in nature. Okay, however, there are some good examples which you can quote, such as Kerala has made efforts to provide adequate healthcare to the people of state, and even the Central government is also making certain strides such as Ayushman Bharat scheme, okay, Ayushman Bharat, and within Ayushman Bharat, Jan Aushadhi Kendras, which provide generic medicines at a lower cost compared to the medicines present in the normal medical shops, okay, and Ayushman Bharat scheme aims to cover insurance of the individuals, okay. So these are certain aspects where India is trying to include everyone in the healthcare facilities. Then, and in this chapter they have provided the best example of the particular country is Costa Rica, which is a country in North America. Mostly it is considered as a Latin American country as it is present in Central America. It is considered as one of the healthiest countries in the continent, mainly because the Costa Rican government curtailed the expenses on the army to spend it on health, education, and other basic needs of the people. It provides them with safe drinking water, sanitation, nutrition, and housing. Okay, they have cut down the expenses on army, and they have provided this expenses which is cut down on the army to healthcare services. Okay, as a result, the health indicators of the people of that particular country have increased. Okay, many use this Costa Rica as an example for improving healthcare services in a country. So this is about this chapter. We'll also see certain data which are provided in this chapter. Those data are so about the status of healthcare in India. India has the largest number of medical colleges in the world and is among the largest producer of the doctors. India is the fourth largest producer of medicines in the world, and most doctors settle in urban areas while people in the rural areas have to travel long distances for medical facilities. We already discussed this. This is a substantiating point for your enhancing your answers. Okay, these are the data which are very important. And about 5 lakh people die from TB every year, while 2 million cases of malaria are reported every year. These data may be old, so you have to check these data with the government records of this particular year. Okay, 2025. In India, a paradoxical situation exists in healthcare system as healthcare resources are uneven. Uneven in the sense, uneven between rich and poor, uneven between urban and rural, uneven between male and female. Okay. So, private and public healthcare. Public healthcare is a chain of health centers, which already discussed. Private healthcare is not owned by or controlled by the government. People have to pay a lot of money for services they use, which already discussed here. And in India, on healthcare and equality, the healthcare in India we can say is unequal in nature, because private healthcare services are increasing but public healthcare services are not. Private services sometimes encourage encourage practices which is unethical. Barely 20% of Indian population can afford medical as they are required during illnesses, and it is the responsibility of government to provide equality healthcare services to its all citizens, especially the poor and the disadvantaged. In 1996, Kerala excuse me, decentralized its healthcare budget at panchayat level to ensure effective health planning. Okay, so this method has been followed lately by Karnataka and many other states also. The best example of healthcare comes from Costa Rica, which I discussed. These are summary of what we already discussed. So this ends our analysis and discussion of chapter 2, that is what is the role of government in healthcare system, and what is health, what is public and private institutions, and what are ODP, and what are RMPs, and what are the status of healthcare in India. Okay, so this ends our discussion on chapter 2. If you like the video, then hit the like button, comment on it, and also share with your friends. With this, I will end the session. Jai Hind.